external jugulars right here. Left and right external jugular, and they're connected by transverse jugular. They're going to come and merge down into the so you could also call this is coming in and merging into subclavian region, and then this is brachiocephalic, which both merge and become the superior vena cava. This is the common trunk for both left and right internal mammary veins dumping into the subclavian. If we come over here, kind of in the little merge segment, what we'd call this little stump here, subclavian vein, you have your costal cervical vein trunk, or costal cervical trunk vein dumping in. It's straining from both vertebral and costal cervical areas. You could say that this segment from here to here is axillary coming in, and you have long thoracic joining back into axillary, ventral thoracic joining back into axillary, and subscapular vein with two branches dumping into axillary. It just has a little, this is subscapular, then it does a little weird thing, so it could sometimes just be a single dumping into there too. And they all dump in, boom, subclavian, brachiocephalic, superior vena cava. Now the last thing is, if you look up here, this branch coming back up from the shoulder and merging in, it either merges high up into the external jugular, or it can merge a little lower to where it's just getting close to subclavian section. That's your transverse scapular vein. Okay? Now there should be this little one right here that's not really dissected out, coming in and dumping in. That's your internal jugular vein. What's that? Then we come down here. And you have, there should be a superficial vein coming right up here and just above the knee, merging in to this vessel here. This would be your saphenous vein. It merges in just above the knee with your femoral vein, which comes up, and as soon as we pass the body wall, we're going to call that external iliac. And coming from inside here, I don't know if we can see it. Oh, there it is. Coming from inside here, that's internal iliac. When external iliac and internal iliac meet, this is common iliac, okay? And then coming into common iliac is your iliolumbar vein. Keep it coming up where the two common iliacs meet. We now are inferior vena cava. Okay? Inferior vena cava receives blood from your renal veins and from your adrenal lumbar veins. And this, coming all the way up here, is your spermatic vein, which is going to merge into the renal and dump into the superior vena cava. Okay? I'm sorry, inferior vena cava. And the inferior vena cava keeps coming up and dumps into the right atrium of the heart.